We were doing very little telehealth medicine, if any at all, before the pandemic. Maybe some controlled prescriptions for Adderall or those type of things for college kids. And then once this started, it just took off. I mean, we're at 99% now, probably, of our patients that we're doing telehealth visits for. And I've been able to help out a couple patients with brand new heart failure, which is a little bit tricky. And the rewarding part for me is that I've been able to touch base with them a day later, 2 days later, which we didn't normally do. And that's worked out great, helped these people out. I had a patient that I was able to see him for telehealth, hard to control, difficult to control diabetes. And so he showed up on my schedule today and we made some changes regarding his diabetes. And he actually made the suggestion, hey, why don't we do this again in 2 weeks? A lot of these chronic care situations, and the example of diabetes is great because when you make these changes, the old way of doing it was, I'll see you in 3 months in the office. And you just lose so much when you have such a long time for follow-up. Certainly a gratifying thing about telehealth is being able to look at where they live, and you get a little glimpse of their living situation, and they give us a little bit of a tour. The one guy showed me his pond, but the one guy, I kept looking at his wall, and I'm like, what is that on his wall? And I had thought like he won a couple trophies at the yacht club. So I'm like, what are all those trophies? He's like, oh, those are my Emmys. And he had 30 Emmys. So they're a little better than a yacht club trophy. Certainly there is so many opportunities to help people out and to do more outreach to people. And I'm excited to see where it's going to take us.